Today, let's discuss about a very atypical case of scoliosis. To start with, it was a simple case of scoliosis, but it was neglected. So as we all know, scoliosis is usually seen in children, but a patient came to me with scoliosis, but her age was 32. So she had very bad scoliosis because of clear neglect, fearing the surgery. So she had a double major scoliosis, that is, she had a huge severe scoliosis in her thoracic spine, and there was an opposite curve in her lumbar spine balancing the spine so that the head is straight. However, when we offered the surgery and to worsen the situation, the patient was achondroplasia, that is, the patient was a dwarf. Though she was 32-year-old, she was hardly 3 feet 9 inches in height. So as we all know, the dwarf, the skeleton is small. So we had took an CT scan to understand the scoliosis curve and the structure of the bone. When we got to the CT scan, we understood that the bones were very, very small. So we had to order a special implants so that the screws fit into her bones of the exact size so that we can put adequate pressure to correct the scoliosis. So we have explained all the risks and complications, and the degree of the curve was very, very big, and the amount of forces we were putting to correct the scoliosis will be enormous. So we had explained everything in detail prior. When the family accepted the risks and complications and said a go ahead for the surgery, we operated the patient. We had put screws and we did many osteotomies to get the spine straight. We have done a T2 to L4 fixation, and we got both the curves corrected, that is in the thoracic spine and also in the lumbar spine, to a near total straight spine. The patient was made to walk the very next day, and she had little pain for the amount of surgery we had done. The patient was quite comfortable the very next day and was walking by her own. The parents and the family were very happy because many of the hospitals had denied surgery, citing huge complications because the patient was achondroplasia. However, we delivered good amount of correction to the spine. We had literally a normal straight spine in this kid.